Good afternoon, everybody. Many thanks for joining us at the joint ILC UK and ILC Singapore webinar, Healthy Aging and Adult Vaccination in Singapore and Hong Kong, as part of the ILC Global Alliance's 30th anniversary celebrations. Before we get started, there are a few housekeeping rules to go through. Internet issues may affect sound and video, so please do bear with us if this occurs. At the bottom of your screen, you will see a chat function to communicate with panelists and delegates, as well as a Q&A feature where we will be collecting questions for the panelists. If you are having any issues with the audio or video throughout the webinar, try to connect with an Ethernet cable or through hotspot on your phone. If you get disconnected from the webinar, do use the same link from the confirmation email to join back in. You are all invited to post comments on Twitter using #HealthyAging. This webinar will be recorded and published for public access on our website and YouTube channel. Today, our expert panel of speakers will share ILC work on healthy aging and adult immunization in Singapore and Hong Kong. We will be discussing recent learnings and changes resulting from COVID-19 and debate the similarities and differences between the situation in Hong Kong and Singapore. We will then want to hear your views in the Q&A section. Do submit your questions to our speakers using the Q&A feature in the bottom bar of your screen throughout, and join the conversation on Twitter using @ILCUK, @ILC Global, and #HealthyAging. I'm now going to introduce our first speaker, Dr. Wai Chong, Clinical Program Consultant at the South Foundation, who will give his presentation on the ILC work on improving adult immunization uptake in Singapore and highlight how things have changed over the past year in the context of COVID-19. Dr. Wai Chong, as we fondly call him, has been a practicing community aged care family physician since the late 90s. Mostly as a home care physician working within a multidisciplinary team. His areas of interests include primary health care for the frail, elder abuse, dementia care, end-of-life care, and the development of sustainable community aged care system. Wai Chong, please.
Thank you. Good evening and good morning, everyone, and good afternoon, depending on where you are. I'm very honored to be here sharing with you a piece of research. We collaborated with ILC UK last year in Singapore. So we conducted a public seminar, and then after that we had a roundtable session asking people from various sectors of the healthcare scene in Singapore. So we have representation from private clinics, from public polyclinics. We have representation from the public hospitals, geriatricians, infectious disease physicians. We have representation from intermediate and long-term care sectors, doctors from the community hospitals, and directors of nursing homes and day center practices. And then we have public health practitioners and representation from the non-profit sectors and research and policy workers. So this was a roundtable conducted and with the help from ILC UK. Next slide, please. So today I'm sharing with you the main findings and the main series of recommendations with some updates since then. So the main findings related to policies and practices validated with participants around table was that there was a national effort in developing and commissioning the development of this adult immunization schedule, which was published in November 2017 by an expert committee on infectious disease by MOH. And also around the same time in 2017, MediSave was allowed to be used for funding vaccination. And it was based on the MediSave 500 scheme And on top of that, there is also a certain amount of funds in the MediSave, which is compulsory savings for all Singaporean in our Central Provident Fund. So there's this Flexi MediSave, which up to $200 a year, you can either use your own MediSave account or your spouse. But the practice regarding adult vaccination is that it is non-mandatory. It is up to the individual to own the responsibility to learn about vaccination and then approach the healthcare providers and mainly the doctors to seek more advice and recommendation. And the vaccination has to be prescribed by the doctors. So this was the practices, and from the ground we realized that there were some flaws and some challenges even with that funding. So, for example, the MediSave 500 scheme, it was $500 per person per year, and this $500 is not just used for vaccination; it is also to be shared with managing our chronic diseases. There were 20 of them that you are allowed to tap into these compulsory savings, 500 per year, such as your diabetes care, your high blood pressure, your cholesterol, dementia, and so on. But recently it was announced in July that Ministry of Health have enhanced subsidies for vaccination. So starting from the beginning of next month, there'll be better subsidy. Next slide, please. So the next slide summarizes the recommendation from the expert committee for adult vaccination. So if you can focus on the people above the age of 65, the main vaccines that were recommended on this schedule are influenza, pneumococcus conjugate PCV13, and pneumococcus polysaccharide vaccine PPSV23. But there are the others as well, the tetanus, diphtheria, but those are relevant for people who are pregnant, and hepatitis, mumps, measles, rubella, and varicella. Clinically, most Singaporeans, especially the older age group, we can assume that they have got previous exposure and of chicken pox and mumps, measles, and rubella. So it is not widely practiced, but it is in the adult vaccination schedule. And the chart below is my own compilation of the latest in the government subsidies. For example, the most expensive vaccine is the PCV13. In our clinic, we charge around 135 Singapore dollars before GST per dose of the PCV13. And so after the subsidy, if you are within the pioneer generation, that is, you're born before 1949, you only need to pay $16 at most for PCV13. And then if you have got, for our international audience here, the Merdeka generation was recently for people who are born before 1959 and after 1949. So these are, we call the Merdeka generation. They were born during the period of our independence, when we are newly independent. And CHAS is Community Health Assist Scheme. There's a blue and orange. These are all based on household income, per capita income in the family. So it's blue color connotes that the income is relatively low, orange is a little bit higher, but green is for the rest of the Singaporeans. So regardless of your income, non-CHAS are those who are Singapore citizens, but they did not apply for CHAS subsidy. So regardless, as long as you're Singapore citizens, there are extensive subsidies. So PCV13 market price is about 135, and then you have extensive subsidies. So this is the latest update on our policy. So next slide, please. So during the focus group, the roundtable discussion, there were a lot of very extensive contribution. People were sharing their best practices and also their challenges. How did they overcome them? And then together we came up with some recommendations, which will be in our on my last slide. So the challenges first, there is a relative low uptake. So for example, in one of the representatives from the public sector primary care centers. We call them the polyclinics. They see about 60 to 70 thousand patients per month, and sorry, I think that's per year, and they only manage to vaccinate around 2 to 5% of them for influenza and pneumococcal disease respectively. And in a survey done across the Singapore in 2016 and 2017 is 12 and 14% respectively for older adults 65 to 74 years. So this is really quite low compared with the United States. I think it's about 50%. Low public awareness. So for example, there was a geriatrician who said that he observed that there is we don't really have a culture of vaccination. So most of the time it is an afterthought. So it's a low public awareness. And there was a survey done among adults 21 to 70 years of age. Only 20% reported the willingness to consider vaccination next year. So the public awareness is really quite low. And worse still, there was also a paper that was published in Vaccine, the journal, that found that conducted among healthcare workers, doctors, nurses, pharmacists, and found that many believe that influenza vaccine can lead to influenza and that it is not efficacious and that they are not vulnerable. They don't even think that vaccinating themselves can contribute to reducing the spread of influenza in the community. So this was really quite alarming. So next slide, please. So two other challenges, the underuse of allied health professionals. So unlike in North America where I witnessed, private pharmacies are giving vaccinations. So in Singapore, only doctors are allowed to prescribe and give the vaccinations. And from one of the hospital doctors was saying that doctors are the worst to ask patients for vaccination because they're so busy. And the pharmacists and nurses, on the contrary, are often the ones to recommend vaccinations and other health promoting and disease preventing good measures. Unfortunately, the legislation does not allow them to prescribe. And there's a lack of data. So also someone practicing in the hospital was commenting that is it better to over or under vaccinate? Why? Because the information is not widespread. There were a lot of silos. For example, if a private general practitioner does not subscribe to, say, one of the more widely used government sanctioned electronic medical record system, then the only record available for vaccination is only in his paper document or on his own private electronic medical record system. So there's improvement. Now, National Electronic Health Record is island-wide, and if you're from the public hospital, public polyclinics, some GP clinics, if you give vaccination, it will be there. So I do take reference from it, but it is not universal. So there's always a risk that the person has been vaccinated elsewhere and it's not known at the other segments of the healthcare system. Next slide, please. So the way forward, so jointly as a roundtable, we sort of analyze the policies, the barriers and challenges that we face, and we discuss some of the best practices. Like, for example, in one of the community hospital, the CEO and the medical director would be the first to go for vaccination, and they'll publicize widely in the intranet. And then Tzu Ji, one of the very well-known non-profit organization in Singapore, they will do vaccination campaigns to different parts of Singapore, and together with health screening and health promoting activities to raise awareness about vaccination. So way forward, we feel that there should be more financial incentives and packages to overcome the financial barriers to those at most risk. So through not just for vaccination, but also active aging, exercises, and health screening. So there could be some kind of financial packages for this. So since then, of course, we now know there is much better subsidies now for vaccination, but it's still quite passive. Older person take ownership of getting vaccination. The second point that we recommended was that there should be some investment in top-down and bottom-up educational efforts to normalize adult vaccination and improve health literacy. Because of the very low public awareness, So more public education campaigns, older people as ambassadors, even prominent celebrities or even politicians going for vaccinations, just to raise the profile that vaccination is really important, and then increase training and simplify the guidelines. So we do know that there are still a lot of doctors and healthcare workers. They are not well informed. They are not really they don't themselves believe in vaccination. And so just to add, since the beginning of this pandemic, there have been, especially at the beginning in January and February, there was increased public awareness about influenza vaccination and pneumococcal vaccination. There was a lot of public discussion about the fact that you should have vaccination to reduce the noise in the background when we are tackling this quite unknown new virus. Last slide, please. Sorry, the next slide. So 2 more points of recommendation. We thought of that we should expand the use of team-based models of working to divorce patients from a GP-centric view of healthcare while investing in allied health professionals to play a greater role. So currently there is a new policy that is called National Collaborative, sorry, I can't remember the full name, but this gave a means and a pathway for allied health workers, such as pharmacists and nurses, to prescribe medication, including vaccination. So perhaps vaccination could be part and parcel of this particular new practice. Lastly, expanding the scope of the national data collection on adult vaccination to better inform policy and medical decisions on adult vaccination. So to address the last challenge that we have, that the information are still in silos. The very last slide is a slide of acknowledgement. Next, please. So, so we have those in Singapore, very recognized senior geriatricians, long-term care facilities workers, community hospitals, and infectious disease specialists were all in the panel. So that's all from me. Thank you very much.
Thank you very much, Dr. Ung. Let me now hear from the response and some thoughts and feedback from about the presentation from Ms. Yeo Wan Ling, the Director of Women and Family Unit, National Trades Union Congress. Thank you very much for joining us. As Director of USME, Ms. Yeo Wan Ling works with SMEs and tripartite partners to boost productivity through innovation and enhance SMEs employment practices so as to improve the wages, welfare, and work prospects of SME employees. As Director of the Women and Family Unit, she will further strengthen NTUC's reach to women, help protect their livelihoods, and support their careers so they can reach their full potential. As with all senior members of staff at NTUC, Ms. Yeo Wan Ling will also engage NTUC's affiliated unions and associations so as to better understand and speak up on ground concerns. Thank you very much for joining us this afternoon, Ms. Yeo Wan Ling, please, your thoughts.
Thank you so much, Susanna. I feel that I'm in a company of really old friends. I think, Susanna, you've known me for many, many years already, and you've seen me in many, many different incarnations. So yes, so right now I'm with the National Trades Union Congress, which is actually almost like the union body in Singapore. And besides this, I'm also a member of parliament from one of the areas in Singapore, and it's actually in the northeast. It's a fairly young town called Punggol Town. And prior to this, I think Susanna knew me when I was the CEO of a company called Caregiver Asia, and that's a platform, an online platform where we work with freelance caregivers for people who need care at home. So I think, right, it is with this perspective when Susanna and Dr. Ng asked me whether or not I wanted to be on this panel, it's like, yes, of course. So I think my response today is a little bit more from the angle of the community. how some of the announcements that has been made due to the very good recommendations of the roundtable that was facilitated by Dr. Ng has affected, some of the plans that we intend to do when it comes to the rollout of adult vaccination in our community. And also at the same time, right, taking a page from, the other job that I have, which is over at the NTUC, is also seeing how we can also reach out to older workers, adult workers within the workspace itself. So if I could just summarize, some of the key learnings that we took from the community and from the report, I think there were three very, very important and pertinent things that we learned. The first thing first, right, was actually the importance of preventive measures. I think all of us know about vaccination for little kids, but not a lot is known actually for vaccination in adults, and particularly vaccination that can actually span all the way to people right in their 60s. So this was something, right, that that I think the report was really quite good, at penning this down. But a related point to this was also at the same time, a lot of adults, especially the elderly in Singapore, don't really see vaccination as a key part of their healthcare. A lot of it, right, tends to be more on the, when I get sick, and what can I do when I get sick? And so not a lot is done actually on the preventive portion. I think part of it also has to do with the fact that we actually have a national program for medical healthcare, and that's actually that's what Dr. Ng had mentioned, which is actually something called MediSafe. And so a lot of the older adults here, they look upon that as a nest egg, which they will keep, with them quite. They hold it quite tight, in terms of how they spend it. And I think with this, what happens, right, is that there has been I would say quite a delay, or would I say there's a lot of misinformation about them using this for preventive cases such as vaccination. So I think this was actually the first key takeaway. The second one, right, which I think Dr. Ng had very generously talked about, was actually the linking vaccination or the advice on vaccination from doctors. And I know that, Dr. Ng is actually a doctor himself. So, but, I think in Singapore itself, within the community, as well as within the healthcare world, there has always been a large movement towards looking at healthcare being, I would say, disseminated from just only, not only from doctors, but into allied healthcare workers. And I would dare say, and I would talk about it a little bit later on in what we intend to do in my community, was that we want to take this an additional step further to not just only at allied healthcare providers level, such as nurses, but also right into the area of caregivers as well as ambassadors. And so I'll talk about that a little bit later on. But I think this is actually quite important because it helps to disseminate the information better in a more fluid way within the whole entire industry, as well as within the community. And I think the last one, right, is actually fake news. It's a very trending topic that we are talking about here in Singapore, like hashtag fake news. But I think, right, vaccination does has its fair share of like such news, and within that itself, I think there needs to be a charm offensive, to let the adult to let adults know that there is, a lot of good when it comes to vaccination. So maybe what I can do, right, is to talk about some of the popularity, the popular news, right, that came from this three, and the reaction from it from the community itself. So the first bit, right, was actually, we talked about how a lot of adults don't see this, as particularly something that they want to spend their MediSafe, their healthcare nest egg on. But I think, right, suffice to say, I thought it was a very good thing that in 2017, we as a government, we addressed the importance of adult vaccination. And with that, right, we actually created a whole entire a department around that, which is the NAIS, which Dr. Ng had talked about it. And I think, right, once you formalize this, it actually gives a lot of space for this topic to be talked about. And of course, one of it, right, was how adult vaccination, right, extends from 18 years old all the way until above 65. Particularly towards the end part, I think a lot of, not end part, I think towards the older part, I think a lot of people don't know that actually vaccination was available there, partly because of the popularity of the HPV immunization that is done, right, in women who are younger in age. But having said this, I think this part was actually very important, that you actually formalized, you know, adult vaccination through a department, a government department. And of course, it was very complementary to the NCIS, which is the one, right, for children. I think, right, Dr. Ng had talked about, you know, how affordable it was for vaccination. And one of my key takeaways was that actually, right, the vaccination cost just between Singapore $9 all the way to $65, you know, across 11 different types of different vaccines that you can be looking at. And so this is, of course, you know, something that we spoke about. Dr. Ng did speak quite a lot about influenza, pneumococcal, you know, and all that. But beyond that, right, there's also like measles, mumps, you know, hepatitis V, as well as chickenpox, you know, and I actually think, right, that here in Singapore and Asia, measles, mumps, and chickenpox is something, right, that quite a number of adults do face, and it's a painful condition. So I do believe, right, that a good charm offensive can be done there, and especially since there is, you know, already a vaccine out there that's affordable, I think that's great. Another number that I think, right, needs to be known, and I think it's a very popular thing, is also the fact, right, that the vaccinations are at 75% subsidy levels, 75%. Imagine. So I think this is something that it's a rhetoric that I think, right, needs to be spread more within the community itself. And also Dr. Ng had spoken about the Pioneer and Merdeka generations. So in a way, what happens in Singapore, we actually grouped people across certain age bands together, you know, and gave them a name, the generation a name, Merdeka as well as Pioneer. So actually on top of that 75%, we're also looking at another 25 to 50% off that 75. So to me, I feel that once we position this well, you know, and spread this to community, I don't think, right, the first point of people not looking at vaccination because they want to save their nest eggs, right, would be something that would carry very far, you know. And in fact, I think this was a wonderful initiative by the NAIS to look at, you know, to counter discourse that, you know, that vaccination is actually expensive. So I think that's the first thing. I think the second thing, right, which is actually on healthcare, on how a lot of the information is actually disseminated through the GPs, through the doctors, right, into the community, especially the importance of vaccination. I actually think that that's actually a super valid point, because in the community, and especially in the community that I run, we actually do have a lot of doctors. You know, we have doctors, right, both from the national level, as Dr. Ng has spoken about this, is actually the polyclinics. But beyond that too, we also have private practitioners, the GPs. But right in the community of like, we have about 70,000 odd households. This is serviced, right, only by 5 GPs. And I definitely don't think, right, the power of network here really does work, right, through just only the GP network. And we're not talking about administering the vaccination, we're talking about letting people know about it. So I think definitely, you know, if we can upskill some of our caregivers into understanding, you know, and being able, right, to talk about this, talk about vaccination, point people where they can actually get their vaccinations, and also tell them about like the 75%, you know, discount that they're getting, right, with the grant. I think this would be really good. So I know Dr. Ng had spoken about, like, you know, nurses, you know, allied health professionals as a way, you know, to disseminate and to connect with people on this. But I want to push this a little bit further, because I think we have something called community leaders. And these are people, right, who are not in the caregiving arena, they're not healthcare professionals, but they care about the community. So already we had some early steps that we've taken with this, with the Silver Generation Office. So in Singapore, we actually do have a lot of all these programs, and the Silver Generation Office, right, are actually a band of ambassadors that go around and connect quite deeply with the residents in their community about various things. I think when it first started off, it was actually a extension of what we could do with befriending. But beyond that itself, I think, right, a whole series of being able to let them know about vaccination so they can spread the word is actually quite important. I think too, within this level as well, and everyone's going through COVID-19, and I think there is some systemic unemployment, or more employment in Singapore. Maybe another thing that we can look at too is actually beyond the silver generation ambassadors, also to look at community people who want to step up, and maybe pay them a stipend, for going around telling people about vaccinations and pointing them to, where they can be doing this. In Asia, I think Hong Kong, Singapore, Taiwan, there is actually a loose network, and we nick them the Yakult aunties. So Yakult, right, is actually like a probiotic drink that a lot of Asians drink. I take a bottle every day too. It's something that I drink right since I was a kid. But what happens is the Yakult aunties go around knocking on the doors of the community and neighbors, selling Yakult. But I can so imagine this, right, being transformed a little bit. You sell Yakult, but also at the same time talk about, care things. And this is something that probably we would want to start introducing within my community in Punggol Town. Another thing, right, which is the last point I made was actually fake news. So we're trying to combat fake news. And I think Dr. Ng, you're absolutely right. I think we would need to do this, right, via various very creative ways. You talk about celebrities and politicians and all that. And yes, I think this has been very effective. So just to give you a similar parallel, what happens, right, is that my town is a town which actually does quite a lot of blood donation. So we have the Red Cross coming in and all that. And believe it or not, because like a lot of community leaders, we go in and then we also do like, blood donation. Actually, right, the last round that we did, it was actually over 100% oversubscribed on the people wanting to donate. So I do think, right, leading by example is something that's quite important. Also, I think, right, celebrities is one thing, but can we also look at local celebrities? I bet in every single town, right, there is, a champion inside there, or maybe there is a champion celebrity inside there, whether or not it's somebody who is a Ge Tai singer, whether it's somebody, right, who is on an ethnic level, a religious leader as well. I think these are, people that we can bank on, to spread the message of vaccination. After all, it's about healthcare. And also I want to do a little plug on workplace. I think what happens is in Singapore's workplaces, we're highly organized. A lot of our actually a lot of our companies are unionized, and I think, right, this could be a very, very good way in which we could go through the unions, to talk about the welfare of employees, and vaccination is something definitely we can talk about. So I would very much like to see that this initiative is also passed and spread through the local community, right, via the workplace. And I think this is something that we haven't really talked about, and it's probably something that we can work together on as well. Okay, so this is my response, to the very wonderful roundtable that Dr. Ng had done up. Thank you.
Yeah. Thank you, Wanli. Actually, you're right. You have enhanced the roundtable discussions results with your ideas, which we will certainly come back to you with some
Okay, please.
potential collaboration. I think the
Yes,
idea of pushing further, including caregivers
yes,
as potentially part of the ambassador and the public
yes,
awareness, because that's always a challenge
yes,
with the subsidy now getting much more accessible in terms of cost.
yes,
I think that's the
yes,
one. So let's continue the conversation.
yes.
Let's
And
move
call me
over
for
now
your
to
next
the
roundtable.
yes, 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 definitely. So we'll
Okay.
go over to the streets and go to Hong Kong now. So I'm gonna introduce David, although he's based in UK. He'll be presenting the result of the study on the ILC work on healthy aging in Hong Kong and highlight the lessons on and how things have changed over the past year in the context of COVID-19. David Sinclair has worked in policy and research on aging and demographic change for the last 15 years. He has a particular interest in older consumers, active aging, financial services, adult vaccination, and the role of technology in an aging society. He has a strong knowledge of UK and global aging society issues, from healthcare to pensions and from housing to transport. David has presented on longevity and demographic change across the world, from Stafford to Seoul and Singapore to Stormont. David Sinclair, please.
Thank you very much, Susanna. And I have to say, I love the idea of the Yakult antis. I think we need something like that over here in the UK. Also really interesting bringing in Taiwan, because actually, if you look at, we did an event last year in Taiwan as well as in Singapore and Hong Kong. And clearly, if you look at the responses to COVID, both, Hong Kong, Singapore, and Taiwan have actually stood out as actually responding very, very well. So we might want to reflect on that. I certainly also share Miss Wan Ling's thoughts in terms of how lovely it is being around friends. And ILC UK have really, really enjoyed working a lot closer with ILC Singapore over the last year or so on this project. Similarly, Pamela, who's going to speak after me, I think we're newer friends, but Pamela's been working with us and joined us in Japan for our event with G20 ministers, and has been working with us on our work around prevention in the broader sense. So it is lovely to be with friends. I also, and I get all the tough gigs, as you know. I was fortunate enough to visit both Hong Kong last March and then Singapore last October to work with colleagues on these. We've published the reports and we will send a link afterwards. But the reason we wanted to do the webinar together is because it allows us to explore some of the similarities and some of the differences between these different areas. Very grateful, I should say, for the grant, a charitable grant we received from Pfizer to support these pieces of work. So let me try and run very quickly through sort of my perspective on where we are with Hong Kong. And clearly, the starting, I suppose the key findings from the work on Hong Kong is very, very similar to Singapore, is that a real focus on a healthcare within the healthcare system on fixing people rather than preventing. In Singapore in particular, some real concerns around, in Hong Kong in particular, real concerns around public primary care services and access to them for particularly poorer older people within the community. There was a sense that things were changing and there was more of a focus on prevention. I know Pamela's going to talk a bit about this, but actually similar to Singapore, within that context, adult vaccination was seen as being very important, but uptake rates were very low. So one of the things, so we took a slightly different approach in Hong Kong, and instead of doing a couple of roundtables, we did some in-depth interviews with 13 experts. And the first thing to reflect, and true of Hong Kong and Singapore, and this was one of the quotes, when I first started looking after older people, they weren't so old. We have seen rapid aging in Hong Kong and Singapore, which presents real different challenges and opportunities. And aging has been a lot more visible than it has been in the UK, because of course we've aged very slowly in the UK. So I think the first message is actually we've aged very, Singapore and Hong Kong are aging very quickly relative to certainly UK, France, Northern Europe. What we also, of course, have this context of, Hong Kong as being a very, very wealthy place, on the one hand, and one of the wealthiest bits of the world. I stayed in a hotel just opposite the horse racing. On the other hand, you have 30% of over 65 classed in poverty. So you have, an evening's worth of racing followed by sometimes very older people after the racing fixing the holes. You've got very significant issues. Hong Kong has been astonishing. One of the quotes from someone: "It's not easy to die in Hong Kong." Actually, what Hong Kong has been really, really successful at is actually supporting supporting people to live longer, and it is, I think, now the longest life expectancy of local citizens in the world. So it is, arguably the place that you see the oldest population in the world. But what you are seeing as well, and this again actually is from my first morning in Hong Kong, the photo, we've got a bit of walking football for older people taking place on outside the in the middle of the horse racing track here. But what you do see is chronic health conditions starting to increase. Being experienced earlier by later population cohorts, number of people with dementia expected to increase, chronic health conditions amongst people 50 to 64 being relatively high. So actually there is this sort of growing concern about yes, we are seeing very significant life expectancy, but is healthy life expectancy matching that? We also see, like in Singapore, a really world-class healthcare system. The healthcare system, one of the most efficient in the world, very, very, very good acute services, but becoming under increasing strain with population aging. But as I say, I think the missing part of the picture was that I think our view and the view of the people we were interviewing was that prevention was taking a lot longer than it should to get up the agenda within the Hong Kong healthcare system. So, and I know Pamela's going to talk about some of the things that have changed, but we had just 73 public general outpatient clinics in Hong Kong for 7.5 million people. There is what you're seeing is a real challenge, real extra pressure going on to accident and emergency departments because of the lack of public primary care services. So it seemed to us that there was a bit of a gap here. Equally, major challenges, as is true across much of the world, but Hong Kong in particular, you see the doctor to population ratio is 1.9 per 1,000 compared to an OECD average of 3.4. And so actually having a skilled workforce is also a challenge for Hong Kong particularly, and whilst there is potential for migration in this space, I think we found that registration requirements were difficult, and indeed language requirements were difficult, and that potentially meant that the problem of sort of skilled healthcare professionals was not going to go away in the short term. Of course, in Hong Kong, like in Singapore, many people pay privately. There are relatively high levels of out of pocket spending, and in 15-16 out of pocket spending on health amounted to about 1/3 of total healthcare spending. I think what I wanted to flag, and I'll come back to this, is of course not all older people were able to afford these payments, which again was what put the pressure on accident and emergency departments. What when you look at sort of the policy environment, I won't say very much about this because I know Pamela's going to talk about it. There were one person said to us that we've lots of money so we can do lots of pilots, and there was this really interesting, I think a really interesting initiative called the Elderly Healthcare Voucher Scheme, which was set up in 2019. Under the scheme, people aged 65 and over got £200 to spend on different services. I think there was a general view of the people we interviewed that this is a really, really good idea, but there were some issues with it. For example, there was some low enrollment issues by private medical vouchers, that vouchers weren't really being used for preventative services as much as they could, that there was an argument of abuse by of the voucher schemes, questions around sort of data and the extent to which the voucher schemes are, we actually know that it's working, but the idea was great that you've got, if you're over 65, you get this voucher and you can spend it on these sorts of services. We did have I think 3 or 4 people who talked about glasses, which was quite an interesting one. So it was obviously a story that had developed in Hong Kong, and I don't know how true it was, but the argument was that lots of people were basically sitting on their £200, letting it build up, because I think you could let it build up for 2 years, and then using it to buy designer glasses. So now I don't know if that's true, but more than one person mentioned it, but it all does highlight the challenge of understanding efficacy in this space. We've also saw really positive development in terms of the health centre, district health centre pilots, and there was a creation in early 2019 of one, and the plan was to open an additional 17. And Pamela's going to talk about these, so I won't say very much. But the idea here, I think, was partly about bringing sort of public health, bringing some of these preventative services closer to where people lived. We found that there was actually that there was healthy aging was getting on the agenda. There were policy initiatives. There were initiatives from people like the Hong Kong Housing Authority. That there were government aging in place strategies, that there was a sense that strategies were starting to happen, but also, and this is a quote from one of the interviewees, everyone's doing something but not in a concerted manner to have the best impact. So there was a feeling that it wasn't as coordinated as it could have been. So the language of scattergun was used. The elderly services program plan seen as more of a checklist than a strategy. So there was a sense that we were starting to see policy change, but actually that we could benefit a bit more for it being a bit more coordinated. In terms of specifically looking at adult vaccination, adult vaccination was a key element of healthcare funded by government. There were in Hong Kong actually essentially free adult vaccinations for influenza and pneumococcal disease. So in some ways you have a free service or heavily subsidized. But actually, like in Singapore, very, very low uptake. So you have a provision there, but actually uptake was not particularly high. What we found was, whilst the vaccination was free, that the limited network of public GPs potentially was one of the reasons why access was a challenge. Just the 73 public outpatient clinics. There was a view that there was limited financial incentives for public GPs to offer the vaccine, and clearly if you don't have the incentive, people aren't going to do it. And that also, whilst access has been increasing through subsidizing private clinics to provide vaccines, patients have to pay the difference in the vaccines cost. So some issues around cost. Also, like in Singapore, issues around low awareness, at both a policy and an individual level, low, and of course we did this last year before COVID, low public awareness of the risk of vaccine preventable diseases. It'd be interesting to know from Pamela whether she thinks this will change, and certainly what we're picking up from across the world is that a sense that particularly flu and pneumococcal disease, there has been a big increase in the last 6 months of interest in this in adults and older adults because of COVID. We found our interviewees argued that government advocacy efforts were fairly limited, but also very significant issues around different ethnic differences in terms of access. So Nepalese older adults having lower awareness compared to Chinese, for example. We, like in Singapore, found there was big issues around access to data, relatively low levels of data to inform public decisions, and that there were few cost effectiveness studies of vaccines and vaccine strategies to help inform decision making. Like in Singapore, very similar issues in terms of healthcare professionals. One person said, why should I get vaccinated if the doctor doesn't? Healthcare workers, seasonal flu uptake, relatively low. Only around half of GPs would actively recommend pneumococcal vaccine to patients aged 65 and over. And what we know from the UK is that the main reasons why someone would get vaccinated is because they've been recommended by a healthcare professional. So if healthcare professionals aren't recommending it, then we won't get it. There was a view that social marketing might play a role, a really interesting initiative back when the influenza vaccine for older adults was initially brought in, where there was an insert with electricity bills, and apparently that helped raise awareness. We found that there were some cultural and cohort barriers. So one of our interviewees said older people don't have a positive impact of vaccination. They say it can make them sick. And of course, there were some, clearly people in their, late 80s, 90s, who actually may have been born before the launch of the Hong Kong childhood immunisation programme, so may not have even sort of engaged with a childhood immunisation programme. There was also a sense that some may see Chinese medicine as a viable alternative to vaccination, and a very strong message around low levels of literacy amongst particularly the oldest old. So again, some of the people in the 80s and 90s, very, very low level of formal education. And this may be an issue. We found that that like in Singapore, that there could be a much greater role for prevention, a greater role, I think, particularly for pharmacists. In Singapore, there were 640 pharmacies at the time, 2,700 pharmacists. They live locally. However, at the moment, what they were, or up until last year, what they were allowed to do was fairly limited. So I think we felt that there could be a stronger role, even if it's just in terms of pharmacists pointing people towards doctors or nurses or other services to help in this space. So finally, what did we, and very, this is where we had very similar sort of recommendations to Singapore. Firstly, the need for data, I think extraordinarily important. Secondly, Ms. Ling Yo talked about ambassadors. This came across really strongly in Hong Kong as well. People talking about actually the need to engage older people as ambassadors and as champions, the role of health education, the role of focusing on adult children to help get messages across was a really, really strong message. And then, as I just said, I think a strong role potentially for pharmacists to have an increasing role. So that was sort of where we got to. Thank you. We were very fortunate to be able to talk to some really, really eminent people. I think a couple of them, Dr. Vivian Liu and Professor Jean Wu, may be joining us today. Really eminent professors and experts in this space. So we were really lucky to have such an expert input. And I'm going to perhaps stop there and pass back to Susanna.
Yes, thank you very much, David. Now we're going to hear a response and feedback on your presentation from Dr. Pamela Tin, who is the Head of Healthcare and Social Development at our Hong Kong Foundation, and where she leads a team of professional researchers dedicated to health and social development policy research in Hong Kong. She received her PhD in public health and has published her work in reputed international journals. Pamela, please.
Hello, thank you. Thank you for that kind introduction, Susanna, and thanks to David for really inviting me here today to speak about the latest happenings in Hong Kong. It's such a pleasure. And it was a fabulous summary you did there, David. So pretty much the landscape of Hong Kong. So today, my job, I think I'm really just going to talk about what the latest updates are in terms of the initiatives that you've talked about. And I must say, actually, I completely agree with you when you say one of the fundamental missing pieces of the puzzle in Hong Kong, despite the fact that we're the most efficient health system in the world, apparently, and also we have a very long living population. It's definitely preventive care and the underdeveloped primary care system, for which I'm going to speak more about in details in my subsequent slides. And next slide, please. So I think a lot of the challenges that we identify in our health system at our Hong Kong Foundation. So we do health policy research, and in 2018, our team put out a report that basically identifies the major challenges of our health system being able to really meet the challenges of the 21st century. And of course, the most fundamental challenges that we identified is the rapidly aging population in Hong Kong, for which David has already mentioned. And so today, approximately 18% of our population is age 65 or above, and that's projected to go up to about 30% by 2030. 36. So basically that's still, we're facing this challenge of a very rapidly aging population and increasing prevalence of chronic diseases. And the challenges that David highlighted in his presentation pretty much, are the same as when he did his study and today where we're at. So we continue to have a relatively hospital-centric health system in general, very conventional, yet we advocate, of course, to move towards a relatively person-centered and primary care-led health system that focuses on prevention. And I mean, in terms of the actual system itself and how the government, how policies are geared towards this movement from the conventional system towards a more primary care-led system, we're pleased to see the government roll out, for example, mention in the policy address that they to recognize the importance and the urgency of reorienting the entire healthcare system. And I will talk about the different efforts that have been done to really move towards this newer sort of orientation later. But in general terms, Hong Kong, we've been talking about the importance of developing primary care for decades, really. But we're still slow in terms of the entire development. As David mentioned, we have high out-of-pocket spending, which particularly in the private sector that remains unaffordable to many. In general, we have a relatively fragmented and segmented healthcare system because in Hong Kong we have what we call, I guess, a pluralistic healthcare system, very segmented public system and a private system that offers relatively expensive services. Next slide, please. So this is, in a nutshell, some of the major happenings of primary care development in Hong Kong. As I mentioned that we've been talking about the importance of primary care development for decades now. In 1990, released a document entitled Health for All and the Way Ahead, which generally examined the primary care system and really how to reform the primary care system because in anticipation of an aging population. And gradually, of course, there were related services focused on preventative care that were rolled out. So, for example, the Elderly Health Service in 1998. And then more recently, a program that David had mentioned, the Elderly Health Care Voucher Scheme, rolled out in 2009, for which I will speak a little bit more about in a later slide. And then in 2010, we had a creation of a primary care office, and then we had the creation of a primary care directory, which primarily sought to identify the primary care providers in our community to let our citizens know where they can actually seek that primary care. And then for this particular government administration, primary care has always been at the top of the health policy agenda. So in 2017, a steering committee on primary care development was officially set up by the government with view that they will lead primary care development in Hong Kong. And other related efforts related to primary care development and also preventative care in Hong Kong, including the Towards 2025, which is a strategy and action plan focused on the prevention of non-communicable diseases in Hong Kong, and then other efforts such as the Hong Kong Cancer Strategy. And then another milestone would be the District Health Centre that David had also briefly mentioned, and I will talk a bit more about later, and subsequent efforts to scale up this particular plan to different districts in Hong Kong. Next slide, please. So I'd first like to talk about the District Health Centre initiative. This is a key initiative by the current administration to roll out or to develop primary care in Hong Kong. Fundamentally, the idea is really for each of the 18 districts in Hong Kong to have what we call a district health centre. So you can view this as a sort of primary care hub, really with vision to make it convenient for citizens within the district to seek primary care services, which includes, for example, health risk assessment, advice on patient empowerment programs, and also advice on how to manage chronic diseases and so on and so forth. And the first district health center out of the potential 18 was rolled out in September 2019, which is in the Kwai Ching district. And basically now it's about, it has been in service for about a year now. So of course, the fundamental aspects of this, of all district health centers, is to make it so that it's community-based, really leveraging on not just the center as a primary service hub itself, but really expanding the network out to the different, for example, private sector doctors, allied health professionals, NGOs, community-based organizations and social services, etc., really to create a whole entire district-based network so that people or citizens within the district can seek relevant services easily. So and also a lot of the this district health center, one of the characteristics is that it promotes medical and social collaboration. So as I said, it really it's not just about sort of health risk assessment and looking for advice from medical practitioners, but really also links the citizens to social welfare, social workers, the help from social workers, etc. And so also this center leverages on the importance of public-private partnership to enhance service provision. And of course, while this center has been rolled out, and by the end of last year, there were approximately 2,000 plus members who had used services from the district health center, as well as a strong team of about, I think, at least 60 healthcare professionals and social care professionals who work in this center. This is not including the network services. For example, private sector doctors that are district-based but not working inside the center itself. So, but there have been actual concerns with how well the service model is rolling out. So, for example, our team managed to speak to some key stakeholders of the field from the perspective of policymakers, also from service providers and from end users of the system, that have given different views on potential things that could be improved in terms of service provision of district healthcare centers. So, for example, some stakeholders have said that, you know, this model is really based on a top-down approach. So because needs assessment was conducted in order to tailor the services of the services provided from the center to citizens within the district, yet because it's a rather top-down approach, it leaves little room for service providers or the implementers of the district health center services to really change service model to suit the needs of citizens who really participate and go to the district health center. And also there has been talk to say that there's insufficient use of patient information and data to inform service model. So it's about really, again, the inflexibility of service model to tailor for the needs of citizens and the actual service model limitations. So, for example, some have reflected that while most of the services are subsidized to some extent, say, for example, if a patient goes to the district health center for health assessment and they get referred to medical checks in the private sector, then, of course, for the first few appointments, they get subsidized, so they only have to do co-payment, and then they get subsidized by the government for $250, I think it is. But then subsequently, drugs are not included in the subsidy, and also if we go beyond that $250, or if we go beyond the 2 times that the patients are subsidized, then there's no more subsidy, and the patients, then some of them cannot afford services in the private sector any longer. So then also some patients have told us about insufficient promotion of district health center services. It's fundamentally located in a building on the 30th floor. So it's to some people, it's quite inaccessible to that extent. And also in general, so that because this district health center, it doesn't no doctors are stationed in the center. So this also, a lot of citizens might also have a sort of resistant towards use of services, as in Hong Kong, the health system is fundamentally very doctor-centric to a certain extent, and people just love to seek care from specialists. So that's why people don't really trust the services here. But despite that, we are still rolling out, or the government is still rolling out different district health centers in other districts. They've identified at least they aim to have 6 districts rolled out by 2022, and also they also plan to set out sort of DHC express stations, so intermediary stations, that simplified versions of district health centers in 11 districts also in the coming years. Next slide, please. So another initiative that David had mentioned is the elderly healthcare voucher scheme. Of course, I think in response to David's comment about optometry services and designer glasses, it's actually true that there was a recent evaluation done on the effectiveness of the elderly healthcare voucher scheme. Fundamentally, there are 2 main aims of this scheme. First of all, it's to provide subsidy to elderly individuals to seek primary care, or primarily preventative care services. And secondly, also, it's an attempt to shift care burden from the public into the private sector. So I'll talk a little bit about how effective that was. But about the optometry services, the report had stated that people are really using a lot of money from the voucher scheme just to buy designer glasses. And so there was a revision in terms of policy that limits the amount that could be spent on optometry services to $2,000 every 2 years. So there has been constant monitoring and evaluation and revision in terms of the scheme. But in terms of effectiveness of meeting its fundamental initial aims, the voucher scheme, as you can see on the graph on the left, really a lot of the times voucher claim transactions recorded a lot of the times have been used for the management of acute episodic conditions, and only about less than 10% of the transactions on average have been used for preventative care, some on rehabilitation, but mostly on acute episodic care. So in terms of the voucher for really being able to achieve its initial aims for promoting primary care uptake, that remains quite questionable. And possible reason for that is because of the overall design of the voucher scheme, that it doesn't have very targeted services in general, while its aim states it's really to increase uptake of primary care, but the services that the voucher could be used in is not very targeted. And also on the graph on the right, you can see that in actuality, prior to the use of the voucher, about 49% of the population sought care from the public and private sector doctors, but after using the voucher, this dual utilization, we call it, actually shot up to 61%. So what that really fundamentally means is that care is not being actually shifted from the public to the private sector. Rather, people start using services from both sectors. So to that extent, the effectiveness of shifting or lifting care burden in the public sector, which is very, very heavy at the moment, has not been completely effective either. Next slide, please. So I think on this note, in terms of primary care development, in terms of recent developments in Hong Kong, I just briefly, very, very briefly mention how we're doing amidst the COVID pandemic. Despite the relatively underdeveloped primary care system in Hong Kong, very hospital-centric, of course, when we care about COVID-19 patients, a lot of the services, a lot of the treatment happens in public hospitals in Hong Kong. There have been initiatives to shift burden from public hospitals so that they can focus on COVID-19 patients to the private sector. For example, the initiation of several public-private partnership services. But also we're talking about not just treatment or curative centric, but also sort of preventative, where we recently rolled out a universal community testing program for COVID-19 just to identify silent carriers, and the uptake was about 24% of the population. So in terms of preventative services, that was an initiative. Next slide, please. And finally, I'd just like to really stress on the fact that I think I agree with David in terms of the fact that different initiatives in our healthcare system, very sporadic, very relatively fragmented, a lot of pilot projects going on, but also we really love to leverage on the power of the community. And this was particularly exemplified during the times of COVID, where community efforts were very evident. So different organizations in our community really stepped up their role, reached out to different vulnerable groups of the population. For example, the elderly, the disabled, and also ethnic minority groups, etc., to really help them improve their health and amidst the times of the pandemic, and also really let them know how to tackle COVID-19. So that's just really worth highlighting in terms of the community efforts. So I think in view of time, I'll just stop here and we'll continue the discussion and conversation with other panelists. Thank you.
Thank you very much, Pamela. Thank you to all the panelists for your presentations. We're now going to open up for questions from the audience. And I'm taking note in the Q&A tab that there are actually 8 questions already there. So let me acknowledge question from Umanta Das, or is it Sumanta Das? How can we ensure adult vaccination awareness takes a leap, and how do you foresee adult vaccination by 2025? I think Hong Kong has this magic number of year 2025. For Singapore, it's 2030 in terms of the number of older people. So so you could either respond from Hong Kong, or any response from Singapore as well. How can we take a leap? Really, like
well, perhaps I can take a stab at this.
Yes.
So I think COVID-19 is really life-changing for a lot of us. It's very disruptive. And perhaps the raising awareness related to vaccination could ride on this current hyper awareness about infectious disease and the need that we need to vaccinate, particularly for the older people, influenza, pneumococcus, because these viruses and bacteria can lead to pneumonia. And if you have pneumonia, I need to test you for COVID-19 until proven otherwise. And then you'll be quarantined or isolated for the first few days before the result is out. So for all these reasons, there is like an opportunity here that we can raise awareness about influenza and pneumococcus. And I think this could be the leap that we're talking about.
Anybody else from the panel?
Yeah, I think I would completely agree with Wai Chong in the sense that it's about health literacy and really getting more people aware, and COVID-19 pandemic is definitely a window of opportunity in my view. I think that it's useful again to continue to leverage on the power of the community. Our idea of, for example, district health centers really is to reach out to community members, because supposedly these are the people within the district health center, they are the people who should know the people within the district most in terms of their needs and wants and so on. And so I think also with an adequate sort of development in primary care provision, etc., that also would help with the development of increasing health literacy. So one of the things I think also is because I think one of the panelists also mentioned the importance of having adult children to really step up, especially, for example, the elderly population, to influence them and to really make them increasingly aware of the importance of preventative care and including vaccination.
Yeah, perhaps I can add to that. I think that clearly COVID has had an impact on the economies of Hong Kong and Singapore, but we still have two very, very wealthy bits of the world. You've got, actually there is some, to a certain extent, a degree of, that I think a real opportunity for Hong Kong and Singapore to lead the world in this space. And my sense from sort of stepping back from both of the countries is that what we've done is develop these amazing healthcare systems, and that there is absolutely interest from policymakers and a recognition of the need to move towards prevention. And I think, to build on what Dr. Nook said, actually, I think that COVID then provides that catalyst for, in both places, a much more vocal conversation alongside the governments. The administration's really starting to put additional resource in this space. So I suspect you will see that, and I wouldn't be surprised if in a few years' time, big bits of the rest of the world weren't coming back to Hong Kong and Singapore and looking at how you'd massively increased uptake over 5 or 6 years. So I think that there is some good opportunities.
Okay, so there's actually the same question by Samrina Bati. So hopefully we've offered some responses. Let's move on. Nicholas McLean asks, does the tradition of less personal privacy than in the West produce better outcomes for the elderly? Who would like to take this question?
Well, I can't say for certain that it is this lack of sensitivity of personal privacy that makes it better for the elderly in Singapore. But I would say that the culture of community spiritedness, of being part of the community, that I think it turned out better. I mean, I'm really talking about the pandemic preparedness and this context that when the policymakers telling us that everybody should wear masks, everybody wears masks, and so I think perhaps it's this community mindedness that helps us. Yeah.
So I actually agree with you, Wai Chong. I think, right, what happens, if you've been, for our foreign friends out there, if you've been following some of our news, we even have apps, like Trace Together and all that, right, where we try to fight the pandemic as a community itself. And I think what happens, right, I think with with the roundtable, and you had spoken about sharing of information across different platforms, but within the healthcare system, I think that will also be quite useful.
Okay. For those of you,
I was just
sorry.
going to say that, I think that, no, completely. I think one thing we've got to be really careful about is assuming that, there is a single model in the West, as in indeed assuming there is a single model in, in places like Singapore and Hong Kong. Actually, the work we're doing on prevention of ill health, I think there's a very strong message that no matter where you live, there is huge diversity in the sort of in individuals who are in the community. So I remember in the Singapore session we were talking about how do we support sort of freelance taxi drivers with vaccination, and how do we support domestic care workers and domestic and that actually and how do we support both communities have very sort of historic high levels of migration coming in for huge diverse bits of the world. So I think we've got to and let me slightly defend the UK a little bit, in the West we do have a bit of community over here.
Yes. Yeah. So for if you have additional questions, please post your questions here. And then for those of you using social media, please use the hashtag healthy aging to ask questions. Okay. Let's try and see what else are the other questions here. There's one. How might COVID-19 affect the primary care systems in Singapore and Hong Kong?
Well, being a primary care doctor myself, recently I set up a clinic of my own, and I realized that perhaps it doesn't make a lot of sense. Well, I'm a bit, I'm just thinking perhaps a bit of a hit that to have a brick and mortar at this stage, because I witnessed that there is a boom in the use of telemedicine, and perhaps you need a clinic in order to dispense your medication. But really, I think there is going to be a lot of changes in the healthcare sector. So as it is now, what we notice is that a lot of primary care clinics are now geared up for overcoming this pandemic. Many are they are actually pandemic preparedness clinics, and then they do COVID-19 testing, and also because of this particular pandemic, a lot of people with minor ailments like cough and colds and diarrheas, they don't really see the GP so much now. And so I think the jury is still out. We need to do some collection of evidence to support this. But anecdotally, you do see there's a huge impact on the primary care sector in the way we practice general practice kind of medicine, urgent care, and the delivery of primary health care. A lot of it is online now.
Yeah, and to follow up the question to you, Wai Chong, by USA, it seems uptake of vaccine is a challenge. What are the main factors and barriers?
Yeah, actually, we in the analysis of based on the roundtable, we do find that there's a lot of this low awareness, and even the healthcare workers are not really for it. But I feel there's something even more fundamental. It's about health-seeking behavior. A lot of people, they will only look for healthcare when they are sick. They don't invest enough in preventive health and health promotion unless it's really, really convenient for them. It's really about lifestyle values, but also the challenge, competition from other parts of life that demands our attention. So I'm wondering whether something as important as vaccination, health promotion, can it be left to market economy? Consumers seeking healthcare and then pay for this. So among all the challenges that I raised from the roundtable, from low awareness, cost to there's also something else about health-seeking behavior that we may want to explore further.
I can come in there, Suzanne, as well. Just about, I think the point of two things. One is that I think we do work in this space across the whole of the world through the ILC Global Alliance and ILC UK, and I think that the barriers that we identify in both of these reports are is it surprising or not, but actually very similar across the whole world. Access to information, awareness, engagement of healthcare professionals, the focus on acute rather than preventative health is probably inevitable in an aging world where policymakers have to make some really tough decisions, and we there will be there are challenges around that. So I think one of the things that's really interesting and is perhaps an opportunity for policymakers is that actually we can see these issues are common everywhere. And perhaps just to come back very quickly on the people only wanting to go to for health services when they're ill, I think extraordinarily important, and I think emphasizes the role of going to places like finding ways of engaging pharmacy and things like that, and other healthcare places. We picked up in Hong Kong, I think, from a couple of our interviewees, that there were some within the Chinese community who didn't, for example, like to go to hospitals when they weren't ill, because it was seen as being there's a degree of superstition around that. So actually, if that is true and that's where you would go for these sorts of services, are there places like the community health centres where you can almost change the narrative around these places?
So I think I'd just like to jump in here, a quick comment about COVID-19 and primary care in Hong Kong. There was actually a recent study conducted among primary care providers or family doctors that really talked about how family doctors continue to provide their services generally during the pandemic, during the worst times of the pandemic, while of course there was a reduced primary care service demand. But then really talking about there was a general view of a shortage of PPE or like how the actual role of primary care in terms of battling COVID-19, because a lot of resources and focus was placed on public hospitals during the pandemic. So really upping the role of primary care, there's a lot that primary care doctors could obviously do, and particularly in terms of improving the health literacy of patients, and with the view of also providing the regular care for non-COVID patients. That's probably something that needs a review of in Hong Kong during terms of the pandemic. What about the people who need regular care yet dare not go to, for example, hospital settings in fear of hospital-acquired infections, and in general going to general medical care settings in general. So that's probably the role of primary care doctors as well.
Thank you. I'd like to ask Wan Ling, Wai Chong has talked about health-seeking behavior. You've worked with caregivers in the community, you've had plenty of experience. What could be the pivotal, like the teachable moment in financial education? We talk about the teachable moment, because when you have caregiver, you have an interface with the older person, older adult. Have you had, what could really trigger for them to really think through about that this is should be part of my preventative health, and that, because now cost is kind of out of the
Yes.
question, so
Yeah.
it's not going to be an issue now. So but that health seeking behavior of individuals, especially of older adults, how can we kind of really touch that?
Yeah, actually, I was just going to answer that question that one of our audience put up, which is like, like how do we see the leap happening? Actually, I think in Singapore, it has to do with the fact that there's a 75% subsidy, and I think with this, right, there will be a leap and there will be a tick up. But, to answer your question, actually, right, I want to take leave from this idea of primary healthcare, and I want to go into community care, actually speaking the same language. And having the same culture as the elderly loved one. I think one of the reasons why our ambassadors have been so successful at engaging with the elderly in our community at a very deep level, it's really because, right, they spend upwards of half an hour with them, speaking, talking to them. It is a kind of befriending, but it is befriending plus. Because there's actually an ultimate message that goes behind that messaging. If it's something about mental wellness, they will talk about, the importance of reaching out and not be isolated, and I think, right, in the same case, if it's vaccination, there's a whole entire story you can build around it. But I think amongst all these things, with community care, it's actually being of the same culture and speaking the same language as the elderly loved ones. I think, right, Hong Kong and Singapore are actually quite similar in the sense that it's multiracial, it's multi-language, and it's multicultural. And sometimes, right, it could be as simple, right, as speaking the same dialect, or connecting on a level that, I'm also of that, same particular dialect group, that actually opens the door for, conversations such as vaccination to happen. I think the other one is actually looking for influences. I'm not talking about the social media influences. When I gave my commentary just now, I had spoken about community heroes and community celebrities. It's actually being relatable. I relate to you because you are somebody I trust, and you believe in this, and you have done this. So I think, right, that to me, right, beats all the, healthcare reasoning and all that when reaching out to elderly loved ones. It's really about that community touch. It's about being able to relate. I think that's actually a key point.
Yeah, thank you very much for that. We have actually a very good kind of offer as well as a welcome actually from Goncalo Pinto, representing International Pharmaceutical Federation, with over 4 million pharmacists. He says that actually pharmacists in at least 36 countries are actually looking forward to being part of the discussion if there are future discussions on how we can really change the health seeking behavior, or at least influence the health seeking behavior. What role can they play in this in increasing and enhancing uptake of adult vaccination? So I think we will all welcome that offer by the pharmaceutical pharmacists organization, no, for both Hong Kong and Singapore, no. Yeah. Any last words from any of the panelists? Because I'm conscious of the time. Yeah.
Perhaps 10 seconds from me, or 20 from me,
Yes.
Susanna, and huge thanks again to all of our speakers. I think for me that there are clearly similarities in terms of the rapid aging, in terms of the excellent healthcare systems, in terms of a recognition from policymakers of the need to move more towards prevention, and then also picking up on Gonzalo's point there, a recognition of, in a world with skills shortages, of needing to use all sorts of different professionals, including pharmacists and nurses and others. And as I say, my sense and hope is that places like Singapore and Hong Kong will be leading the world in this area, and then in the next couple of years we'll be coming back and trying to work out how you did it. So I'm going to stop there.
Yep,
So
yep.
from me, I'd just like to reiterate a point that I made just now, that this is a crisis, but it's also a golden opportunity for us to raise awareness about preventive health and health promotion, preventive care and health promotion, particularly the message around vaccination. And so now COVID-19 is very high on our priority. So perhaps we could really start a campaign about adult vaccination, also riding on what Wan Ling talked about, the new enhanced subsidies, which is really, really attractive, that we can really push the agenda about adult vaccination.
Pamela?
I think from me, once again, thank you for organizing this lovely conversation. I think one of the things we've really focused on talking about is how we can do better in terms of promoting preventative care. And for me, especially in Hong Kong, how we can do better in terms of primary care development. As well as, I think I'd like to emphasize on the role of the community using a bottom-up approach. But I also think it's important to leverage on COVID-19, as what Wai Chung said, is a golden opportunity. In particular, like today, we know of the weaknesses of different health systems, how we have coped with crises, but also we learn from the lessons that are presented in the world. So we exchange knowledge and we engage in conversation, really to learn from each other, so that we can all improve.
Thank you, Wan Ling.
Yeah, so for me, right, I think COVID-19 not only is an excellent opportunity for us to bring adult immunization up to the foreground. I actually think, right, COVID-19 brought along a lot of community spirit. I think in Singapore, there is a campaign, SG United, that went on really, really strong. It is about harnessing and also aggregating, right, the force of the community to do good. And I believe, right, this is here to stay. And I do believe, right, in order for adult vaccination to really, push out in the community, in the Chinese word, 发扬光大, it's really through the power of the community. It's getting your influences in, it's getting your community leaders in. It might be even driving a bus around
Yes.
the neighborhoods and just let them know that, hey, look, this is happening, and we're bringing it into your neighborhood. So I think, right, the future is very bright for adult vaccination to take off in Singapore.
Yes, thank you very much to all our speakers and everyone who joined us for this very informative webinar today. I just want to add the key takeaway for me is really the power of the community. And then how we can leverage that from the bottom up. And then also, I think for me as an adult, that's kind of like having all this news as well is very important to kind of be able to digest which one is really like, can really support what is
Yeah.
the effectiveness of vaccination. I do believe in it, but it's how can I use that belief and be able to relate and communicate that. That I think is the important thing, so that then we can actually really harness the power of the community in terms of leveraging. So thank you for everybody who joined us. Thank you for spending your morning, early morning, late evening, or afternoon with us. I just want to kind of like announce a few things on behalf of the organizers. Actually, ILC Singapore, South Foundation, and Aging Asia had been rolling out a webinar series that focuses on the future opportunities and outlook of life in the new normal. We're trying to understand what could be the new normal in Singapore could look like. So we have been having webinar series. There's two more. One is going to be on the 28th of October, which will focus on older people and function in the times of COVID. Last night, we had one on social isolation, safety versus sanity. And the last one will be as part of the Aging Asia 2020 World Aging Festival. Dr. Marian Sao, our chairperson and president of ILC Singapore and co-president of the ILC Global Alliance, will be presenting the result of this series of webinars that would hopefully offer some new insights into the new normal for older people in Singapore. And join us as well if so you can visit the website of World Aging Festival. You can also visit the website of the Aging Asia. For news on ILC UK's latest webinars and to stay up to date with all ILC UK news, please visit the ILC UK website at ilcuk.org.uk, join their mailing list, and follow them on Facebook and Twitter at ILC UK. There's a few that they would like us to share with you. There's one on October 12th for virtual report launch. This one I'm very much interested. Healthy equals wealthy, the global longevity dividend, which will be presented alongside the G20 finance ministers and central bankers meeting to find out more about their new findings on the value of the longevity economy through spending, working, volunteering, caregiving across the G20, the role of health in delivering a longevity dividend, and how global policymakers can unlock a longevity dividend in the post-COVID recovery and beyond. That's very interesting. If you're interested in sponsoring an ILC UK webinar, please get in touch with Brad Versley from the ILC UK. ILC UK will also be holding its 6th annual Future of Aging conference virtually on Thursday, 3rd of December, exploring how we can ensure policy and practice works for today's as well as tomorrow's older and younger people. Confirmed speakers so far include Sir Michael Marmo, Sir Jonathan Porritt, and Kat Smith, Member of Parliament, among others. Make sure to register now at futureofaging.org.uk to make the most of the early bird prizes that will be active until 11th of October. And with that, I'd like to say thank you again to everybody. Have a good evening, good morning, and good afternoon. And we hope to welcome you all at another ILC webinar or event in the near future. Thank you very much.
Thank you, Susanna.
Thank you.